basically with the ilium. So the ilium, as you see, the ilium is the biggest and the largest. So it's the widest and the largest bone of the tree, and it's located basically superiorly at the at the top of all the tree bones. And basically, the body of this ilium form the superior part of the sternum. This is the superior part of the roof. Basically, this is made by the sternum, by the ilium. And then just immediately above the sternum, you have something called the wing or the ala. So you see this form like a wing. This is called the wing of the ilium. This is just above the roof of the sternum. This is how the ilium is formed. Okay, so this is the largest and the widest bone. Regarding the surface, so the ilium itself have two surfaces. One surface is from inside and one surface from outside. The inner surface is concave and the outer surface is convex. So this is articulating the inner surface. You have the iliacus muscle, and the outer surface you have the gluteal muscle. So this is the attachment for the muscles, so the inner surface and outer surface. So this is as you see here the iliac fossa. Here you have an attachment for the iliacus muscle, and the external surface here you can see some depression or landmark where the attachment of the gluteal muscle. We have three glutea. Remember, the gluteus minimus and medius and maximus are all attached to this surface. Then you have this superior margin. You can see the superior margin of the wing. It's thickening. It's making a thickness, and at the end, it's forming something called the iliac crest. Okay, this is the iliac crest, and then anterior and posterior, you have a pointed surface. This is, we call it the anterior superior iliac spine, and then you have here the posterior superior iliac spine. So these are the extension of the iliac crest, which is the widening of the superior margin. And then at the end, you have, at the back of the posterior surface, you have a depression. This depression or an indentations, we call it the greater sciatic notch. You can see it at the posterior surface of the ilium. Okay. So far, so good, everybody? Okay. So what's the importance of the iliac spine? This is very important clinically. You have two important landmarks. So one is, they call it the mid-inguinal point. So the mid-inguinal point. So if you take, basically it's a halfway between the anterior, this is the one, between the anterior superior iliac spine and then between the center of the pubic symphysis. So this is the center of pubic symphysis. And then if you extend the line all the way to the anterior superior iliac spine, you can palpate at the midline, you can palpate the femoral artery. This is the first landmark, and we call it the mid-inguinal point. And then you have midpoint of the inguinal ligament. So you have the inguinal ligament. Basically, this is extending between the anterior superior iliac spine, but instead of going to the pubic symphysis, it's only extended from the pubic tubercle, and you have you have the deep inguinal ring. Remember, guys, when you take the abdomen, remember the deep and the superficial inguinal ring. Yeah. So this is important for if you want to test for hernia or if you test for abnormalities in this region. Okay. So far, so good, everybody. Okay. So far, these information are not new. I expect you to know most of these information. So we've done with the ilium. Now we're going to talk about the pubis. Okay, so this is the pubis. Let's see if we can put this down. Yeah, okay. So the pubis basically composed of three parts. So you have the body. Okay, this is the pubis. So you have the body of the pubis, and then you have two rami. One rami we call it the superior rami, and one we call it the inferior rami. So you see, this is the superior rami, this is the body, and this is the inferior rami. Okay, so the body is basically located medially. You see, it's located medially. This is basically the body, and here you see the body. And the important landmark you have the rounded thickening, which is basically you have two important structures. You have the pubic crest and you have the pubic tubercle. And you can see here, this is the tubercle and the crest is more medially. So lateral, so at the near to the pubic symphysis, as you have the crest near the midline, and then lateral to that, you have the tubercle, everybody. Is that clear? And then you have two rami. One superior rami, and basically expanded laterally. You see this rami expanded laterally and forming part of the acetabulum. You see it's making part of the acetabulum. This is part of the acetabulum. And then the inferior rami just project and articulate with the other part of the ischium. This is the ischium bone. Okay? And together, the superior and inferior rami form this foramen or opening. Remember the obturator foramen, guys? So the obturator foramen is very important for the obturator artery and nerves. Basically, they're traveling to reach the medial side of the thigh to supply remember the muscle of the thigh, the medial muscles. Basically, most of them is innervated by the obturator nerve. Okay. Then you have the ischium. So the ischium basically forms the posterior inferior part, and basically the ischium has a body, and same thing like the pubis has a body and have inferior and superior rami, and the inferior rami combine with the pubic rami, and basically they form something called the ischiopubic ramus. This is ischiopubic ramus. Okay. Why is ischiopubic? Because it's part of the ischium and part of the pubis. Okay, and then the part of the posterior inferior part have very important structure. This is basically called the ischial tuberosity. The ischial tuberosity is where we sit on. So this is the location where you're sitting. And where your weight is when you're sitting down, all your weight lies on this part of the ischium bone. And then near the junction of the superior rami and the body, there is an important structure called the spine. So between the body and between the inferior rami, you have here the ischial spine. Okay, these are the landmark of the ischium. Okay, guys. All right. Then you have two important ligaments. I hope that this is again not new to you. You have taken this before. So you have two important ligaments. One we call it sacrospinous, because it's coming from the sacrum all the way to the spine. Okay, to the ischial spine. So this is basically forming the greater sciatic foramen. And you have another one which called the sacrotuberous, because it's coming from the sacrum all the way to the sacral tuberosity, and this is forming the lesser sciatic foramen. This is all structure. There are some structure, and this is not the focus of this lecture, but this is very important when you're studying the pelvis, that there are some structure passing, like there's structure passing from the obturator foramen. There are some structure that pass through the greater sciatic foramen, and there are some structure that pass through the lesser sciatic foramen. Okay, so now we're done with the bone. So we talked about the three bony important part of the pelvis. Okay, and then we talked about their formation and the important landmarks. Now we're going to talk about very important structure, basically the pelvic floor. So basically, all the pelvic viscera, you have the bladder, you have the rectum, you have the genitalic organs, and also the terminal part of the urethra. All of these guys reside in this pelvic cavity. This is all the space in the pelvic cavity. We call this the true pelvis, and this is basically located beneath the pelvic brim. This is the pelvic brim. All these structures are located below these boundaries. So all these structures are found here, and important structure. This is found in this cavity, and they are supported by something called the pelvic floor. So there are a number of muscles that make up this cavity, and there's a lateral wall are formed by the obturator internals muscle, and then you have a proformis muscle. This is muscle that we studied in the lower limb, remember guys? And then there are pelvic floor. You see this pelvic floor? This is we call the pelvic diaphragm. This pelvic diaphragm is very important for suspending the genitalia and also suspending the rectum, and also helping you controlling your defecation and controlling your urinations, and also when you are coughing or sneezing, controlling your pressure, how much pressure you're putting inside the pelvic cavity. Okay, makes sense? So this because it's a muscular floor, it's susceptible for injury. So we're going to talk about what's it's important and what could happen to them. But we'll start first of all about what are the muscles that form this floor. So basically, as you see in this image, this is like a funnel shape. So it's coming like a funnel shape and suspending these organs. And they are they attach to the lesser pelvis, and they're separating the pelvic cavity from the perineum. So you have the area, this is the area here above, we call the pelvic cavity, and area here below this we call the perineum. Okay, this is something you're going to talk understand in more details. The perineum is the area where you have the external genitalia, and between the organs of the urinations and defecations, this is all are suspending the perineum. And in order for you to allow for unification, there are two important openings or holes. So one we call it the urogenital hiatus, and one we call the rectal hiatus. So this is called the rectal hiatus, and this is the urogenital hiatus. So the urogenital hiatus have the opening of the female urethra, and also have the opening for the vagina, and also for the rectal, it's basically suspending the last part of the colon, which is the anal canal. Okay, everybody? So we're going to talk about these muscles that form this pelvic diaphragm. So before we do that, let's talk about the function. So the importance of this pelvic floor basically support the pelvic viscera. So they are supporting and helping them in the contractions, and the resistance to increase in the intra-abdominal pressure, especially during your coughing or when you're lifting something heavy, and also controlling urinary and fecal continuous. So basically, this muscle acts as a sphincter and helping you control your defecations and control your urination. So when you relax these muscles, you can basically urinate or defecate. So there are three important components of these muscles. Basically, you have a levator ani muscles, and these levator ani have another three muscles. We'll talk about it. And then you have a coccygeus muscle, and then you have the fascia that cover them. So we're going to be focusing about the muscles that form this floor. Okay. So the levator ani muscles, this is very important, guys, are innervated by pudendal nerve. And I'm focusing on pudendal nerve, and I want you to tell you, at the end of the lecture, I'll tell you the pudendal nerve is one of the nerves that's susceptible to injury, especially during operation that's in that region, like somebody have, female that have delivery. This can really damage if it's the head of the baby is too large, and then there is some tear in that perineum region that could really damage the pudendal nerve, or there is an operation surgery that's done in that region. So the levator ani muscle have three important parts. One is called the pupococcygeus, and one muscle is called the puborectalis, and the other one is called the iliococcygeus. As you see, this is the three muscle here, the puborectalis. So the puborectalis, this is the first one. Okay, and then you have the pubococcygeus. This is the pubococcygeus. Okay, and then you have the iliococcygeus, because it's coming from the ilia all the way to the coccyx. Okay, We'll talk about each one of these muscles. We'll talk about, first of all, about the pubococcygeus. This is the main one that constitute the levator ani. So this is the pubococcygeus. It's you see here, it's in a green color, and it's arise from the body of the pubic bone. That's why we call it pubococcygeus, because it's coming from the pubic bone. And then the fiber make some direction around the urogenital hiatus, okay? And then it attached to the coccyx and the anococcygeal ligament. So you see that there is an attachment here to the coccyx and also to the ligament at the back here. The puborectalis is a U-shaped muscle. This is the puborectalis muscle. From its name, puborectalis, it's coming from the body of the pubic bones and then past the urogenital hiatus around the anal canal. So it's very important. From its name, puborectalis, this muscle have an important function for the anal canal because there's a 90-degree angle in the anorectal junction that it helps you in controlling the defecation. So if there's a problem with this muscle, the person might have issue with the defecations, okay? So this is the main function of this muscle, is to maintain the fecal continuous. So it helps the person control the defecation. Okay, guys? And then there's some fibers that also contribute to the urethra and also helping to the urethra and also helping you in controlling the urinary. But this is another function that's this puborectalis give rise to. The other muscle is the iliorectalis. So the iliococcygeus. So the iliococcygeus, it's coming from the ilium all the way to the coccygeus. So this is it has thin fibers, and then and this is attached to the coccyx and the anococcygeal ligament. Okay. This is the main levator of the tree. So basically, it helps to elevate the floor. So it keep the floor of the pelvic diaphragm supported. If this muscle is damaged, somebody will have something called a prolapse. What do we mean by prolapse? The viscera can fall down. Make sense, guys? So it's suspending the pelvic, cavity and the organs on the pelvic cavity. Okay. The final muscle. This doesn't belong to the levator ani. This is a muscle by itself. We call it the coccygeus. This is innervated by anterior rami. It's not innervated like the other one by what? Remember the other one? Pudendal nerve, yes. So this is the smaller one and the most posterior one. And it's suited anteriorly, more anteriorly than the others. And this is originate from the ischial spine and travel laterally to the sacrum and coccyx, okay, with the sacrospinous ligament. This is important. This is the most important slide because it's telling you why we're studying this and why this is important. So first of all, the levator ani, guys, it's involved in supporting the fetal head during cervix dilation in childhood delivery. So during the delivery, this is the important muscle that support the head of the baby during the delivery. And during the childbirth, the levator ani and pudendal nerve are at high risk of damage, like what I said earlier. So the pubococcygeus and puborectalis are the most prone to injury. So if somebody have an injury to pubococcygeus or puborectalis, you might expect they might have problem with urinations, or they might have problem with the defecations. And I'm sure if some of you have family members that have a baby, you can ask them if the baby was born with a bigger than normal weight. The female usually after delivery will have problem, keeping the urine or controlling the urination. If she's coughing or sneezing, the urine might, just go out without, involuntarily. Make sense, guys? Because the urination, and then the cases is varied. according how much damage is done. But again, there's different modalities. Sometimes they give them some exercise to help the muscle, but if there is a damage to the nerve, it's more serious than that. So the urinary incontinence is the most noticeable during activity where intra-abdominal pressure is increased. As I told you, the patient, you will tell you, when I cough, when I sneeze, when I lift heavy or stuff, my urine is released involuntarily. Then you understand that there's a problem with the this levator ani muscle, and you can ask the person about history of operation or history of child delivery. Make sense, everybody? Yeah. Okay. So again, this is what I told you. The muscle is supporting the head of the baby, and this is where the damage can happen. And sometimes, because the head of the baby is so large, the doctor might need to do an incision. You understand what I mean by an incision? So they need to cut through the levator ani muscles, and then if it's not repaired properly, or if the nerve is damaged, this could lead to a serious complication after the delivery. Okay, so I think this is the last slide. Do you guys have any question?
Doctor, there's another slide. Prolapse.
There's what?
There's another slide.
There's another slide? Yeah. Oh, sorry, yeah. Yeah, I just talked about briefly that. The prolapse, basically, the pelvic viscera, like the vagina or the bladder, there's a trauma that can happen to this muscle, and then the structure is prolapsed, okay? So do you find the person, his structure is, it says fall down, right? So it's fall down from its space. So this can be repaired surgically if it's a major problem, or sometimes they give them some exercise in order for them to support the structure again. Okay.
Doctor?
Yes.
The prolapse occurs when there is a tear with the coccygeus and the levator ani.
Yes. Yes. You need to damage both muscle in order. But the main one is contributing to the support. Remember, we talked about it? Yeah. Okay, everybody? Is it clear? Okay, perfect. Online, do you have any question? No question online? All right. So the slide is on Moodle. And yeah, I think you know what to do. Okay, guys? Okay, see you soon, inshallah. Assalamu alaikum.